Swayam Prabha. Digital India. Educated India.
Hello everyone, I again welcome you to the course Nursing Research and Statistics. So today we will be starting with the lecture 2, Research Process. I am Dr. Harmeet Kaurkang, Principal, Chitkara School of Health Sciences, Chitkara University, Punjab. Let us see the objectives of today's lecture. At the end of this lecture, you will be able to understand the phases and steps of quantitative research process, and you will be able to apply the steps of research process while conducting the individual or group research projects. Now, before going into the research process, I would like to emphasize on the understanding of quantitative and qualitative research process. Although at undergraduate level, you will be studying the quantitative research process in detail, but you should have an understanding that how the qualitative research is different from the quantitative research. So if we talk about quantitative research first, the quantitative research is defined as a systematic investigation of phenomena by gathering quantifiable data and performing statistical, mathematical and computational techniques. So quantitative research, name only says quantitative. It means here we gather quantifiable data. Quantifiable means the data which is in numeric form. Another important thing which you have to notice is systematic investigation. So systematic investigation means it follows orderly process. It follows a systematic process of investigation to get an answer to any question. And whatever data, numeric data which we gather, we perform the statistical and mathematical or computational techniques to interpret that data. So quantitative research process, you need to understand that here we gather the quantifiable data, and after gathering the data we perform the statistical techniques and then analyze, and then we interpret the findings. And most important thing is that quantitative research follows a systematic investigation. Now let us talk about the qualitative research. So qualitative research is a type of social science research that collects and works with non-numerical data. So please remember, it works with the non-numerical data, which is usually in narrative form, and that seeks to interpret meaning from these data that help understand social life through the study of targeted populations or places. So here we collect the in-depth data which is in narrative form, which is non-numerical data, and from that in-depth data we interpret the meaning and we try to understand some phenomena, particularly social phenomena. Right? So here we have not written systematic investigation. Systematic investigation because qualitative research does not follow any systematic investigation. The researcher may change the different phases depending upon the need of the study. So that is the main difference between the quantitative and the qualitative research. Now we will be discussing in depth the quantitative research process. So quantitative research process involves the study where the researcher moves from the beginning point of the study. So beginning point of the study is posing of a question. So we need to start with a question or issue or the problem, and then we follow the orderly process till the end point, that is obtaining of an answer. And it follows a fairly linear sequence of steps that is broadly similar across studies. It follows linear sequence, means it follows systematic investigation, and some steps sometimes may overlap depending upon the study design, and some steps may not be needed sometimes, but majorly it follows linear sequence of steps, and we will be studying all those steps one by one. Now, talking about the different phases of quantitative research, the phase 1 involves the conceptual phase, where we conceptualize the problem or question, where we read, we theorize, we reconceptualize, and we review. So that is why this is known as conceptual phase. Second one is designing and planning phase. So after the conceptual phase, when the question is ready, when you have studied the literature, you know the background of the study, then you start designing and planning of the research study. Third phase involves the empirical phase, where the actual data collection occurs. And phase 4 is the analytical phase. So after the data collection, in this phase, we analyze the data. And phase 5 is dissemination phase. Dissemination phase means once you have completed your study, you in this phase you try to communicate your findings to the nursing fraternity. Now let us talk about different phases one by one. So phase 1 is conceptual phase. So conceptual phase is typically, it involves the intellectual element, or you can say it involves strong conceptual or intellectual element. Means here the creativity and intellectual ability of the researcher are needed, because here the researcher has to decide for the research question or the problem on which the researcher want to do the study. Researcher reads the literature, that what is already known about the study or the problem, and what are the exact guidelines or protocol available on that particular problem, and what are the gaps which have been reported in the earlier study. So conceptual phase is having different steps, and I have already told you that these activities which are involved in the conceptual phase are reading, conceptualizing, theorizing, reconceptualizing, and reviewing ideas with the colleagues or advisors. So here we take the help of our colleagues, or we take the help of our faculty members or advisors, who can help us in conceptualizing, who can help us in finding out the research question and finding out the literature. So this is purely a conceptual phase. Now let us see the different steps. So step 1 in the conceptual phase is formulating and delimiting the problem. Formulating and delimiting the problem means here the research questions are posed, right? And the researcher may review the literature, researcher may take the help of seniors to find out the topic or the problem. Second step is reviewing the literature, related literature. So if your question or problem is now identified, then you can go and start reading the literature which is available on your problem or your question. So you may get to know that what is already known about this, what are the research gaps. Step 3 is undertaking the clinical fieldwork. Sometimes clinical fieldwork gives you really a good idea that how can you go for your study, and what are the important practical points which you have to take care while you will be doing your study. And step 4 is defining the framework and developing conceptual definition. So here particularly step 4 is used if your quantitative research study is based upon some theory, then we use some frameworks, or if you are having some concepts, then we define those concepts. Then is step 5 is formulation of hypothesis. Hypothesis means we try to predict the outcomes of our research study. So let us discuss all the steps of this phase one by one. So first step is formulating and delimiting the problem. So here the researchers select a broad problem area first of all. So here it involves, first of all, like you may have some understanding that this is the problem which is available, or you might be interested in some important area, but at the time you don't know exactly what are you going to do. For example, you might be interested in elderly's health problem. Now that is a very broad problem area, because elderlies may have number of health problems, but then slowly after going through or you're going through the literature, or after talking to your seniors, then you can develop the specific questions that what exactly in the elderly healthcare you are going to study. So then you pose the specific questions that are amenable to empirical inquiry which can be tested through the statistical methods, right? So but whenever you are formulating the problem, different points you have to take care, because any problem, even though if you are thinking of a rigorous study and this is a very good problem, you are thinking, but again always you have to keep on asking some questions from yourself. So what type of questions you should ask? One is substantive issues. Substantive issues, under that you can ask the question that is this research question significant given the existing base of knowledge? Means whatever question you have searched, is this question really significant? Will it be adding to the knowledge base of the nursing? If it is not adding anything new, then this problem may not be a useful problem. Second is methodological issues. How can this question best be studied to yield high quality evidence? Sometimes there might be evidence available on the area which you have selected, but whether the earlier studies followed really good methodological steps or not, and what were the gaps in in the methodology of those studies, and then how can you study this question in a way that your methodology should be so sound that you can yield high quality evidence. So these questions are very important, so that whatever finding you will be getting through your study should be useful to our profession. Third one is clinical issues. Could findings from this research be useful in clinical practice? So whatever topic or question you have selected to study, whether it will be helping in the clinical practice, will it be improving the health outcomes of the patients? So these questions are very important before finalizing your research question. Another important thing is that the researcher should be interested in the problem, right? So researcher's own interest is very important. If researcher is not interested, then researcher will not be able to give his 100% to this research study. So that is also very important while formulating and delimiting the problem. So this is the step one, which is very important step of the research process. Okay, now let's talk about the step 2 of conceptual phase, that is reviewing the related literature. You should always remember that quantitative research is always conducted within the context of previous knowledge. So whatever already is known, on that we conduct the research study. Maybe some problems which are posed in the literature, for which we know that this particular problem's incidence is this much, and we need to study this problem, right? So we know about some phenomena, and on that we do the quantitative research. And a thorough literature review provides a foundation on which to base new knowledge. And always the research question which we have decided for our research study is based upon the previous knowledge. So it means we should read the literature fully, so that we can get to know that what is already known about this, what is the background of this problem. For example, I gave you one example of elderly health issues. So you can go and study that what are the elderly health issues which are very important, whose incidences and prevalence is very high, and which is posing the problem or which is decreasing the life expectancy, right? So you get to know about the background, and then you can try and find out that what are the already done studies on this area, and if those studies have been done, what are the gaps. Maybe some methodological gaps might be there, maybe their sample size might be small, maybe those studies might have been done in the other cultures or countries, and you may take the help of those studies to conduct that study in your country, and you can get to know more about this particular problem. So literature review is a very important step which provide a foundation on which to base the new knowledge. So here you need to note that a familiarization with previous studies can also be useful in suggesting research topics. So sometimes literature review, rather than the step 2, it can come before the research question, means it can come before the step 1. So sometimes particularly novice researchers who are undergraduate or even postgraduate students, sometimes it is very difficult for them to identify the problem on which they want to do a research study. So before selecting the research question also, the person can go and review the literature, and sometimes literature might be very useful to suggest the research topic. So thus a literature review sometimes precedes the delineation of the research problem. So it can precede the delineation of the research problem, means before the research question this step can come. And literature review is not only that it comes only at the second step, it can come before the research question, and throughout the study you can keep on reading the literature, and you can really design your study in a better way through the literature review. Step 3 is undertaking the clinical field work. Particularly if you are going to take a research question or research problem which is related to clinical practice, then this step is very, very useful. So spending time in clinical settings, discussing the topic with clinicians and healthcare administrators, and observing current practices. So in the clinical field work, you can go and spend time. You can search for the topics, you can discuss the topics with the clinicians, the nurses or the senior nurses or doctors who are working in the clinical area. Sometimes they may help you to find out the topics for your research study. And you can even observe the current practices, that what is already done in the clinical area and what are the problems they are facing. So clinical fieldwork expands researchers' clinical and conceptual knowledge. So through the clinical fieldwork, you get to know about the concepts in a better way, because otherwise till the second step you are only understanding the problem theoretically. But here you understand the concept from the clinical point of view, from the practical point of view. Sometimes you may feel that this research study is very easy to be conducted in the clinical area, but when you go to the clinical area, you see how the nursing care is provided, how the nurses are very busy from morning to evening, and then you get to know the feasibility of your study, whether it is possible or not, and how you can schedule your research study in the clinical study, so that you should not make any change in the routine of the clinical practices or nursing care of the patients, right? So it helps in improving the knowledge of concepts and the clinical area and the feasibility of the research study. So as I told, it is valuable in developing methodological tools for strengthening the study. So through this, because you get to know that whatever is feasible in the clinical area, you should do the same type of procedures, and you can decide that which methodology will be better. So in the hospital, whether for example, if you want to introduce some intervention in the experimental study, will you be able to? if you will not be able to provide the intervention, then you can think of some non-experimental studies where you can simply observe. So you can develop your methodology after going through the clinical field work. Next stage is defining the framework and developing the conceptual definitions. Many a times our quantitative research studies are based upon previous theories, and these previous theories are used as basis for generating the predictions that can be tested through empirical research. For example, behavioral change, right? So there are a number of theories available that how the people change their behavior, and sometimes many of our quantitative studies are based upon the previous theory. Like for example, if we want to start an intervention for the coronary artery disease patients to change their lifestyle and to make them adhere to the medicines, then we can go and search for a behavioral change theory, and based upon the behavioral change theory we can define our concepts, and based upon that theory we can generate the predictions, right? So sometimes our quantitative study might be based upon the previous theory, so there then we need to define the framework, and then we define the concepts, right? And we give the clear sense of concepts under study. So all the concepts which we are going to study, for example, I told you behavioral change, so maybe our intervention might be motivational counseling. So then we will be defining that what is motivational counseling and what is behavioral change, how are we going to define our behavioral change. So we will give both conceptual definitions, that what are the concepts, and we give the operational definition. So the difference between conceptual definition and operational definition is that conceptual definition is a universal definition, whereas operational definition that how these concepts will be studied in our study. Next phase is formulating the hypothesis. So hypothesis is a statement of researchers' expectation about relationships between the variables under investigation. So a hypothesis is formed to predict the outcomes, right? So researcher expects or researcher predicts that what will be the predicted outcome, or what will be the relationship, the variables which we are studying in our research study. And always the hypotheses are based upon the previous knowledge. For example, research question is hypertension in elders associated with perceived loneliness? So this is the question, right? So we can make a hypothesis. The elders with higher level of perceived loneliness will be more likely to have hypertension than the elders with lower level of perceived loneliness. So means the elderly who will be having the higher level of perceived loneliness, they'll have more hypertension than the elders who will have the lower level of perceived loneliness. So this is the expectation of the researcher. Now after doing the study, this hypothesis can be accepted or rejected depending upon the findings of the study. But always the hypothesis, before making the hypothesis, the researcher read the literature fully and try to understand the concepts, and based upon the previous knowledge the hypotheses are formed, and the prediction of the outcomes are made. Now coming to the phase 2, right? So phase 2 is the design and planning phase. Design and planning phase. So in this particular phase, the research design is planned and how the data will be collected, right? So it will always depend upon your research question. Based upon your research question, you can design or plan the methodology of your research study. So it involves different steps. The first step in this phase is selecting a research design. Second one is developing the protocols for the intervention. Third one is identifying the population to be studied. Next one is designing the sampling plan. specifying methods to measure the research variables, developing methods for safeguarding human or animal rights, and finalizing and reviewing the research plan. Okay, like I have already told that researchers make decisions about the methods and procedures to be used to address the research question and plan for the actual collection of data. So here we decide upon that which methods and procedures we will be using during our study and how the actual data of collection, actual collection of the data will be done, right? So this is planned in this stage. These methodological decisions usually have crucial implication for validity and reliability of the study finding. So this designing and planning phase is very important because whatever methodology you will be using, if this will be a sound methodology, then your study findings can serve as a very good evidence, high quality evidence. But if your methodology is not sound, then it will definitely have crucial implications for validity and reliability. Your findings may not be valid and your findings cannot be consistent, right? So this is very important that you need to study the literature, you need to talk to the experts, and you need to review your decisions so that your methodology should be so sound that you are producing the high quality evidence from your research. Now, the step 6 of the total research process or first step of designing and planning phase is selecting a research design. So what is the research design? Research design is the overall plan. This is the overall plan for obtaining the questions obtaining the answers to the questions being studied. So whatever research question we have posed, how we will be obtaining the answer. So the overall plan is the research design. And in this stage, the researchers specify which specific design will be adopted. So specific design will now be depending upon your research question. Whether your research question will be answered through experimental design or it will be answered through non-experimental design. So your methods will be different for experimental research design and for the non-experimental research design. And if it is experimental design, then what controls will be used to minimize the bias? So in the experimental design, always we need to take care of extraneous variables which can cause the bias. So we need to think about those extraneous variables and we try to control so that we can enhance the interpretability of the results, so that whatever results we are getting, those should be the true results. Research designs also indicate other aspects. For example, how often subjects will be measured. So here we design this research in a way that we explain everything, right? Means the subjects which we will be taking in our study, how we will be measuring and observing, and what type of comparisons will be made, and what type of comparisons will be made, and where the study will take place. So everything is decided in this step where we are deciding about the research design. Next step is developing protocols for intervention. Particularly this step is used for the experimental design, right? So in the experimental design, because we are particularly will be introducing the intervention, so how the intervention will be introduced, for that we step by step guide is made, which is known as protocol. So we develop the protocol that how this intervention will be given to the participants. For example, testing the effect of biofeedback in treating hypertension. Here the independent variable is biofeedback compared with either alternative treatment, that is relaxation therapy, or with no treatment. So we can have the comparison group as an alternative treatment, or we may have a usual treatment, or no new treatment, right? So here we develop the intervention protocol. right? So we develop the intervention protocol for the study, specifying exactly what the biofeedback treatment would entail, means who would administer it. If we are talking about biofeedback mechanism or treatment, who will be administering? Will it be administered by the researcher or research assistants or the nurses who are there in the clinical area, and how frequently, whether it will be only once in a day or morning and evening or morning, afternoon and evening, that exactly the frequency we have to decide, and over how long a period the treatment would last, and how long the treatment will be given, whether it will be for half an hour or 1 hour, that should be decided fully, and what specific equipment will be used, whether you will be using any specific equipment or specific protocol or specific guidelines, that should be decided, and what the alternative condition would be. If alternative condition you are using, then you need to make the protocol for that also. So step by step everything has to be written in the intervention protocol, and whosoever will be collecting the data has to follow all the steps how it is given in the intervention protocol. So intervention protocol is very important, so that each and every subject should get the intervention in the same way. The intervention should not be changing for different persons. If it will be changing, then our study results will not be the valid results. So that is the intervention protocol, which is very clearly written. All the steps are very clear, that should be developed in this particular step. But this is, you need to remember that this is only for experimental design. In the non-experimental design, this step is not needed, because in non-experimental design we collect the data in natural settings. Next step is identifying the population to be studied. Researcher must identify the population to be studied. Population is what? This is the term which refers to aggregate or totality of those conforming to a set of specification. So when we identify a population, it means who are the people who are eligible to be included in our study, right? So but population is the aggregate, means total people who are eligible or who are having some set of specifications which are needed for our study. For example, if I want to do a study on licensed registered nurses of India, then all the registered nurses who are uh, residing in India will be my population. So we need to decide that what will be our population in our research study. Step 9 is designing the sampling plan. Now, researcher always rely upon a sample of subjects who are a subset of the population. Usually, it is not possible to conduct the study on whole population. The example given in the last slide, where I talked about that our population can be registered nurses in India. Now, number of registered nurses in India is very high, and it will not be possible for a researcher to conduct the study on all the registered nurses. Then we need to decide that certain number of subjects we will be including in our sample. So sample is the subset of the population where we select the subjects for our research study. The design of sampling plan include selection of sampling method. So we select that how we will be selecting the subjects in our research study. So we select whether we will be using probability sampling or non-probability sampling. So these are the different methods which are used. So depending upon your research studies requirement, you can use either probability sampling or non-probability sampling. Now probability sampling is where you use the randomization. So you select the subjects randomly, and when you are selecting the subjects randomly, then you give the equal probability to every person in the population to be selected in your sample. Whereas when you are using the non-probability sampling, there is no equal probability of getting selected in the sample. So it will be based upon the judgment of the researcher, or it will be based upon the convenience, right? So depending upon your study, you can go for either probability sampling or non-probability sampling, but majorly in case of experimental designs, we always prefer probability sampling, and for the non-experimental design, we can go for either probability or non-probability sampling. Another thing is specification of the sample size, means number of subjects which you will be including in your sample. Now there are different techniques through which you can find out that how many subjects will be needed in your sample for your research study, and the development of procedure for recruiting the subjects. So sometimes in a research study we may have uh, 2 or 3 groups, and how you will be recruiting those subjects in different groups. For example, in experimental design, we may have one group, experimental group, and the another group might be the control group, right? So how you will be recruiting the subjects or allocating the subjects to experimental and control group, that also you have to plan whenever you are designing your sampling plan. Next step is specifying the methods to measure the research variables. Now here you decide that which methods you will be using to collect the data, right? So researcher select or designs appropriate methods of operationalizing the variables and collecting the data, particularly when we decide our concepts, when we operationally define our concepts or variables. That time we should decide that how we will be measuring these concepts. So usually in our nursing studies, either we use biophysiological measurements through which we measure the biological processes, or for example we measure the vital signs, temperature, pulse, blood pressure. And you can use the self-report measures also, where you can provide the questionnaire to the patient, and patient can self-report. He can give you the information, or you can use the interview. Through the interview you can ask the question, and the subject can give you the information, and or you can observe. And in the quantitative studies, particularly for observation, we use the observation checklist, so that in the end it will be easy for us to analyze the data which we have collected. So whenever researcher is deciding about the methods, he has to be very sure that this particular method will be providing them a really objective information. So this step is very very important, that whatever measures you are using, those measures should be validated, those should be reviewed by the experts. So for example, if you are using the self-report measure, maybe you want to study the depression among patients. Now which particular depression scale you will be using? Will you be using the scale which are already available, which are standardized, whose validity and reliability is already established? Will you be using that, or you will be designing a questionnaire by yourself, right? So that you have to decide, and for that you can take the help of the experts. So before finalizing the data collection plan, researcher must carefully evaluate whether the chosen methods capture key concepts accurately. I have already told you that before finalizing your data collection plan, you have to take care that whatever measures you are using should be able to give you the valid measurements of your concepts or of your variables. Next step is developing methods for safeguarding human or animal rights. Now, in the nursing research, mostly our subjects are humans. So we need to take care that we have to decide about the different procedures, so that we should be adhering to the ethical principles. So the most important thing is to take the written informed consent from the subjects who will be included in your study. So you need to decide that before the data collection, you will be collecting the you will be informing the subjects about your study, and then you will be taking the consent, right? And each aspect of the study plan needs to be reviewed, and we need to review every step, that it should not be infringing upon the rights of the subjects, right? So particularly the subjects who are patients, who are women or pregnant or children, who are really vulnerable, we need to take care really so much, so that we our study should not be infringing upon their rights, and their rights should be protected. And majority of the studies which involve the humans, mostly in the institutions, the researchers, they have to present in front of an external committee, particularly ethics committee, who uh, go through the whole methodology and proposal, and then they give some information that which steps the researcher should change, because those steps might be uh, involving some harm to the subjects who will be the part of your study, and then you may have to change accordingly, and then you resubmit again. So if they feel that your study is following all the ethical principles, then usually you get the permission to conduct the study. Next phase is finalizing and reviewing the research plan. So this is the last phase of the designing and planning phase. Now you have decided upon your research design, you have decided for your methods, your instruments which you will be using, you have planned for protecting the ethics and rights of the human subjects. So now before finalizing, you need to review the research plan fully, right? It means before actually collecting the research data, researcher often performs a number of tests to ensure that plans will work smoothly. So here usually we go for pre-testing. For example, if you are using some questionnaire, you pre-test your questionnaire on some subjects, maybe on 5 or 6 persons, you can give them, and you can ask them to give the answers, and then you ask them that whether all the questions or all the items in the questionnaire are clear to them. Any question should not be ambiguous, or any question they should not feel offended. If you feel, then you during the pretest you feel that some questions you need to modify, then you should modify the questions accordingly. Same way for your methods, you can go for the pilot study, right? So pilot study is a smaller version of your research study. So through the pilot study, whatever methodology you have planned, you will follow that methodology, and you will collect the data on small number of subjects, right? And through this you will get to know that which particular steps which you have included in your study, whether it is practically possible to follow all those steps, or you need to make some changes. So before finalizing, you need to review the research plan, and so that when you will be actually collecting the data, you should not find any difficulty in collecting the data. The next phase is the empirical phase. Empirical phase of the quantitative study involves the actual collection of data, and we prepare the data for analysis. So whatever designing or planning we have done in the last phase, we will be collecting the data in the same way. Another important part is that whatever data we collect, we prepare our data for the analysis in the empirical phase. There are mainly two steps involved. The first step is collecting the data, and second step is preparing the data for analysis. Now step 13 is collecting the data. So the actual collection of data in the quantitative study must proceed according to the pre-established plan. So whatever plan we have developed in our planning phase, we have to follow the full plan, and we should collect the data accordingly. Always whenever you are proceeding for the actual collection of the data, you need to take care that whatever you have decided that where and when the data will be gathered, before that you should conduct the pilot study, and you should decide that what schedule will be good, at what time you should go and collect the data from the patients, right? And for you have to describe the study to the participants, and you need to have everything with you when you are going to collect the data. For example, if you are going to collect the data in the community area, whether you have taken the questionnaire with you, whether you have the data sheet or demographic data sheet with you when you are going to the community. So you have to gather everything with everything, and then you have to go and collect the data, so that you should not find any difficulty when you will be collecting the data. And plus you have to also take care that if you are collecting in community also, you have to take the permission of the villagers, that when what time will be the good time to collect the data. Or if you are collecting in the hospital, you need to take the permission from administrators, and based upon their schedule you should plan whatever schedule they are giving to collect the data, so that you should not be hampering their work when you will be collecting the data. Next phase is preparing the data for analysis. Now you have received the data, maybe you might have given some questionnaires to fill to the subjects, and you have got those questionnaires back. Then you have to perform some preliminary activities, because now you have collected the data. So you have to look through all the questionnaires to determine if they are usable, because many times it happens that the subjects, they give you the questionnaire back after filling, but when you see, then you see that so much of missing information is there. Means they might not have filled the whole questionnaire. Maybe out of 50 questionnaires, they may not have given the information for 10 or 15 questions. So those questionnaires then may not be useful for you, right? So that is very important that you look through all the questionnaires. Second is that once you get the questionnaires from different persons, then you give the identification number. Okay, so usually we give it beforehand when we plan for our sample, we give the numbers. But if you have not given the identification number before, then here you have to give the identification numbers. And you have to code the data. Coding of the data, like for example, you may have certain variables, demographic variables, which are in categorical form. For example, gender, you take in male or female, then you have to code them as 1 to the male and 2 to the female, so that you get whatever information or data you have got, you can change that data in the numerical form, and that numerical data will be amenable for the statistical analysis. So you need to prepare the data for analysis, because whatever raw data is there, that is of no use. You may have huge information with you, but till the time you have not analyzed, that data is of no use, because nobody will be able to interpret that data. So that is why we need to analyze, but before analyzing, we need to prepare the data for analysis. The next phase is the analytic phase. So analytic phase is that whatever quantitative data we have gathered, we need to analyze that. Okay, so whatever quantitative data, till the time it is in raw form, it is not useful. So the data which we gather is subjected to analysis and interpretation, and the analysis is done through number of statistical techniques, right? So analysis can be done through either the descriptive statistics or inferential statistics, and you may use some of the statistical softwares for that, right? So the analytical phase is having two steps. Step 15 is analyzing the data, and step 16 is interpreting the results. So let us talk about the step 15, that is analyzing the data. The quantitative information is usually analyzed through statistical procedures, which I have already told you that we use the statistical procedures, where either you can go for simple descriptive statistics, where you use an average or central tendency, whereas in inferential statistics there are so many sophisticated statistical tests which can be used to compare the data, to find out the relationships or how one variable is changing with the another variable. So statistical analysis is a very important step for analyzing the data, which helps in making the sense of our data. Then step 16 is interpretation of the results. Now interpretation is what? It is the process of making the sense of results and of examining their implications. So interpretation means whatever results now you have got after the analysis, you need to interpret it from the point of view of your research study. And you need to see that whatever results you have got, whether these are similar to the previous studies or these results are different. Then you may need to give the basis that why your results are differing from the previous studies. If it is similar, then what might be the reasons for the similarities, and whether the hypothesis has been accepted or rejected, and basis for acceptance and rejection, and what are the limitations of your study. Everything need to be explained. So to provide sound explanation, researcher not only must be familiar with the clinical issues, prior research and conceptual underpinnings, but must be able to understand the methodological limitations of the study also. So the researcher should be familiar about all the issues or the previous researches which have been conducted on this particular area, and you need to interpret your findings based upon that. And also you should be knowing that what were the limitations of your study, whether your sample size was small or certain steps were not feasible in the area where you have collected the data. Then you can write that in your limitations. And further you need to also give the recommendations for the future study. Next phase is the dissemination phase. So till the time your research study has not been communicated to the nursing fraternity, it is not useful. So this step is very important, where you communicate your findings to the other people. So here there are two steps involved. 17th step is communicating the findings, and the last step is utilizing the findings in the practice. Now let us talk about the step 17, that is communicating the findings. So most important part of research process is this particular step, where the findings of the study must be communicated to nursing fraternity to contribute to the evidence base of nursing. So all should know that what are the findings of your study, so that we can add to the knowledge base, we can add to the evidence base, so that clinical practices can be improved. And the findings can be communicated in the form of term papers. So here whatever research study we have collected, we make a research report. Either we can make the term papers, or we can write the dissertation or thesis, or we can send our research report to a journal article for the journal article, or we can present during the professional conferences. It can be an oral presentation or poster presentation. So these are the different methods through which you can inform the other persons in your profession about the results of your study, and how it can help in improving the clinical practice, or it can help in improving our nursing care, so that it can be useful for the nursing fraternity. Next step is utilizing the findings in practice. The concluding step of high quality study is to plan for its utilization in practice settings. So whatever study results you have got, you should always communicate it to the administrators or to the policymakers, so that they can use the evidence from your study and it can be incorporated into the practice of nursing. So always you should recommend that how this evidence can be incorporated into the practice of nursing, and how it can result in the better outcomes. And it can always result in modification of policies and procedures in a particular organization, whatever study you have conducted, you should communicate your findings to them also. You may either write a mail to them, or you can go and show them your research findings, and you can give them the information that what type of interventions you have used, or what was the methodology of your study, and what are the findings, and how these findings can really help in improving the clinical practice, and in turn can help in improving the health outcomes of the patient, so that you can give your recommendation for the modification of the policies and procedures, and then administrators can follow the same, and they can change the policies and procedures in the hospital. So that is with this step, our quantitative research process is over. So if we summarize the quantitative research process, we have talked about different phases. Phase 1 is conceptual phase, where we talked about how we select the research question, and then literature review, then hypothesis formation, and in the phase 2 we talked about designing and planning of your research study, where you decide about your research design, you decide about your methodology and procedures which you will be following. Phase 3 is empirical phase, where exactly how you have planned, in the same way you collect the data and you prepare the data for analysis. And phase 4, which is the analytical phase, where you analyze your numerical data through the statistical procedures, and you try to interpret the results of your finding. Step 5, which is very important, is dissemination phase, where you communicate your research findings to the nursing fraternity, so that our evidence base of nursing profession can be improved. So with this, the quantitative research process we have completed, and I'll be meeting you now for the next lecture, which will be on the formulation of the research questions, objectives and hypothesis. Thank you.